It's hard to believe that this was 2020. And this was 2020. This is 2021. But this is also 2021. While America's mounting coronavirus death toll has slowed, it's still the world's highest, not per capita, but in terms of sheer numbers. 600,000 people have now died of COVID-19 in the U.S. That's more than anywhere else in the world. But why?
I remember when the cruise ships were coming in, it was really a metaphor for the disease coming onto, our shores. We thought we were invincible because we had superior medicine, we had the superior science. But again, the virus doesn't care how powerful you are in terms of facilities. The virus, at the end of the day, exploits fractured healthcare system. It exploits, public health that's not aligned or at odds with the political leaders. Politics was not aligned with science at all.
Plus a drug.
Then U.S. President Donald Trump publicly contradicted the country's top health experts and their guidance.
No-brainer interventions like masks have been so politicized. So many things like remdesivir, the antiviral drug distribution, followed political lines. So much of the reason why vaccination now is going along political lines.
America's first vaccine was administered in December. Trump promised a quick nationwide rollout, but there were hiccups along the way as demand far outpaced supply, and states fought over precious resources.
If we had a better distribution system that was aligned, if we had a better information technology system that could keep track of people and respond to outbreaks on a local level, we could have, prevented many of these deaths.
Many Americans found themselves unprepared for a pandemic and unprotected from one. And yet, the casualty count disproportionately hit poor Americans and communities of color.
One only has to look at who died in COVID to really understand how flawed the U.S. health system is, even though we're one of the richest nations on earth. And that's because there's maldistribution of health resources. It's not about the immediacy of, there's this new virus and you're going to die from it if you're unlucky. Those risks started decades before, and actually even centuries before. If you think about the systematic structural racism, structural issues that led to the haves and the have-nots in the United States when it comes to healthcare and healthcare access.